to Student Advocacy, Leveraging Health Programming and Events Through Effective Marketing and Communication with Elder Varela. Pardon me. If you have any questions during today's session, please post them in the Q&A at the right of your screen. Elder will answer your questions at the end of the presentation. Now, I would like to introduce you to our speaker, Elder. Elder is currently a Ph.D. student and graduate research fellow in the Department of Health Education and Behavior at the University of Florida. Her research interests include obesity prevention, nutrition education and behavior, policy, systems and environmental changes, social determinants of health, food security, underserved populations, and program evaluation. And with that, we are ready to begin. Elder, if you would, please turn on your camera and microphone, and we're ready to share your screen. Thank you.
All right. Thank you so much for the introduction. My name is Elder Garcia Varela. I am a doctoral candidate at the College of Health and Human Performance at the University of Florida. And today I'm going to be presenting on health promotion programs, planning and evaluation, what is important to use it in our field. So first, a little bit of information about what the presentation is going to be about. First, we're going to talk about program planning. So providing more of a definition that it is a roadmap of where we can get that information that we want to get from our stakeholders, our participants, our investors in the program, and where we want to go and the process to get there, and how you will know that you have successfully get to that plan. We're going to discuss planning models, so how these models speed the planning process and assist in identifying essential elements from program success. And then program evaluation, which is the part of the puzzle where we are using to demonstrate impact on the program and measure outcomes and population health. And finally, talking about the relationship between planning and evaluation and how this is used to assess the progress towards program goals and objectives. So what is program planning? It is a broad field that involves different approaches, including strategic planning, and this can be considered the vision, the mission, values, beliefs, those guiding principles and strategies to set up what your program is about. Then you have your program planning, which are your goals, objectives, activities, as well as the population of your program. And then the operational planning, which are those program implementation components, which is like the time frame of your project, the roles of the different people that are going to be taking a lead on having that program implemented, as well as other types of operational type of logistics that come across in the planning process. So again, the goal of program planning, it is to ensure the development and implementation of an effective and appropriate health prevention or promotion program. So to understand a little bit of what we're going to be discussing today, we're going to focus on the generalized model for program planning. So this is a diagram explaining the different steps of this model, which is kind of the basis or the grounding framework that all of these other approaches use. First, it involves assessing the needs. So before starting the process, you need to collect and analyze some data, and this will come from your priority population. So interviewing or doing focus groups with your priority population, your stakeholders, and with that, identifying what are the priorities, what are those assets, and what even are the barriers that you have encountered in order to implement your program. Then you go into setting some goals and objectives. So in this place, you will be identifying what will be accomplished as part of your program. Then you're going to move into developing interventions, and this will answer how the goals that you have developed will be achieved, and kind of aligning it with your intervention activities. Then you have your implementing intervention. So this is the process where you're putting your intervention into action. So after planning ahead of time and setting your goals and developing those activities, this is where you are going to put it into action. Sometimes people like to do some beta testing or some pilot testing to see how can we implement the intervention in the most efficient way. So doing that trial test to see what can be modified or adapted before a full-on intervention it is executed. And then you do evaluation of the results, which can be done in the form of formative evaluation or summative evaluation. And I'm going to discuss about these terms a little bit later. But it's just kind of assess what the intervention did to improve the quality of the program and also to determine the effectiveness of the program overall. So having this basic knowledge, we're going to move into some specific planning models that are being used in this field, just to get a better sense of, what are some more specific models that you can use when developing your programs. So through the years, there has been various models that have been developed and presented for health promotion. These models are often available to assist in the development of frameworks for community-based population health programs. And as I mentioned, using planning models typically speeds up the process and assists in identifying essential elements for program success. So MAPIT, which stands for Mobilize, Assess, Plan, and Implement and Track, is a framework that produces a comprehensive and a specific plan with reasonable timelines, assigned responsibility, clear objectives, and well-defined action steps. So when I talk about mobilize, what this means is mobilize individuals and organizations that care about the health of the community into a coalition that actually is the one driving this process. Then assess means the areas of greater need in your community and see what resources are available, what are the strengths and what are the weaknesses that you can tap into to address the issues that have been developed in that specific population. So this is kind of like a sequential process. Then you have a plan. You plan your approach and you start with a vision of where you want to be as a community, and then add strategies and action steps to help achieve that vision that you put in place. And then you go ahead and implement your plan using concrete action steps that can be monitored and that you can assess. And then at the end, you have the track, which is tracking the progress over time. And again, this is like goes around like type of approach that it doesn't really end with evaluation, but once you get those answers from your evaluation or that tracking, you go back to your coalition, that mobilization portion to start the process again to reinforce or adapt your program. Another approach or another model is the precede proceed model, and this model has a uniqueness feature that it's an 8-step planning process that begins at the end and focus on the health related outcomes of interest. So I'm going to show you a brief diagram now. So you can see that it starts at the end on phase 1 with quality of life, and then move into the other phases. So I'm gonna briefly describe all of them. So phase 1 is identifying the ultimate desired result. So what is the quality of life, or what is the desired outcome, like a health outcome that you want to target. Phase 2 is identifying, which is the epidemiological assessment. It is identifying and setting priorities among health or community issues and their behavioral and environmental determinants. So again, genetics, behavioral, and environmental determinants, or conditions that can be attained to achieve that result, and identifying the behaviors, lifestyles, and overall environmental factors that affect those issues or conditions. After that, you move into identifying the predisposing, reinforcing, and enabling factors. And I know this is kind of like a crash course on this, but are those factors that align with those initial genetic, behavioral, environmental factors that kind of help you identify what are those behaviors, attitudes, and environmental factors that can be giving out a priority. So for instance, a predisposing factor is something that is within yourself, like the knowledge, your beliefs, your attitudes according to something. Reinforcing are those factors that are outside of your own. So those that are reinforced by policies and laws, and as well as your social networking. So for instance, if you have peers that are engaging in alcohol use, and then you are around them and you're trying to, reduce your intake, then they may be, you'll be taking on the models from your peers. And then enabling factors are just those factors that enable to either partake or not partake in a behavior. So if you have, what are those barriers? What are those opportunities in the communities that enable you to live a conducive, healthy lifestyle? So for instance, do you live in a food desert, in a food swamp? Do you have supermarkets nearby? Do you have recreational centers near you? How is the pavement in your neighborhoods? How is the built environment? Are you able to feel safe whenever you're doing physical activity outside? So those are your enabling factors. Phase 4 will be identifying those administrative and policy assessments, intervention alignments. So identifying those administrative and policy factors that influence what can be implemented. And then phase 5 kind of goes around into the process of finally implementing the program. So the design and actual conducting the intervention. Phase 6 is the process evaluations, or asking, are you actually doing the things that you're planned to do within your program? Phase 7, impact evaluation, asking, is the intervention having the desired impact on the target population? And then phase 8 is the outcome evaluation, when you are asking if the intervention is leading to the outcome of that population health outcome. So are you reducing food insecurity in your population, or are you decreasing the incidence or prevalence of diabetes or obesity in your community based on your intervention? And again, it goes back to that specific quality of life that you identify during your phase 1 social assessment. Another model that we have is intervention mapping, and it takes an ecological approach to understand health problems and to intervene at multiple levels. So as you may be familiar with the social ecological model, it has different layers and different sectors. So you have the individual, the interpersonal, the organizational, the community, and the policy one. So within intervention mapping, you also conduct needs assessment or problem analysis to identify what needs to be changed and for whom. Then you need to start creating kind of those matrices of change, combining those objectives with behaviors and behavioral determinants to kind of see what is the logical flow to take into those program outcomes and objectives. Then you select a theory to kind of take approach into using those methods to match the determinants into which the identified beliefs can be translated into practical solutions. And then 4, you have the program production, which integrates methods and the practical applications into an organized program. So again, refine that program structure and organization, prepare those plans, pre-test and refine those materials that you're producing. Step 5 will be the program implementation plan, which is the plan for adoption, the plan for implementation or sustainability if you already have a program in place, and to kind of adapt it to those real life contexts that you may have experienced whenever you are trying to implement the program. And then the final, as the previous models, it will be to have an evaluation plan and to conduct, the effect and, the impact and process evaluations and see, develop indicators and measurements and have a specific evaluation design in order to conduct those. And one last one that I want to talk about is the social marketing assessment and response tool. This is an kind of approach that started as a lot of our programming often start through social marketing. So it's focusing on consumer orientation at all levels of planning. So thinking about the target population as a consumer and how those different levels can help the planning, the development, implementation, and evaluation. So you have starting the phase one, the preliminary planning, where you're going to identify again the health problem and outline those plans for evaluation and the program costs. Then you have phase two, which is the consumer analysis, where you identify what are the research methods, what the consumer wants, their needs, and their preferences, and have those preliminary ideas for interventions. Then you do a market analysis, so establish and define the market. And assess, the competitors, the allies, the partners. So again, those behaviors, support systems, and partners that helps you carry out the program. Then you have a channel analysis in which you identify appropriate communication of methods and strategies, and as well as the role within your program and who's going to who's going to be taking the lead on the different things, and determine how channels can be used. And again, this can be through social media or just like plain communication via just marketing strategies that are health communication that can be like oral or through presentations or conference and things like that. And then develop intervention materials and pretest, pretty self-explanatory. Then you're going to go with implementing your program. So actively communicating and distributing those strategies and, documenting all the process that happens in order to refine the program. And then finally, your evaluation, in which you're going to assess the degree to which the priority population is receiving the program, the impact, and ensure that the program is being delivered consistently and there is established protocol, and you're able to analyze the changes in the priority population. So I know that was a lot of information, but how to select the planning model? I think that is a very important question since there's so many options out there. But I think you need to start with your preferences of stakeholders. So thinking about the needs and makers, program partners, or your consumers. Also the time and funding. So depending how much funding you have, how many additional extra steps your development is actually allowing you to do. Are you going to have enough time to do your pilot testing? Like, how do you incorporate some of those stages in order to make it work for your program and also to make it effective? Also, resources for data collection and analysis, or those that you don't have. So if you only have one person collecting evaluation, how are you going to have to do this online or in person? Or what areas are you targeting to measure the impact short-term, medium-term, and long-term? Also, the involvement of partners, like, do you have those partners in the community that want to be in the forefront of when you're developing the program? So taking that initial assessment of the problem in the community, you along the way kind of fine-tune those strategies or portions or particular activities within your intervention. And then preferences of the agency funding your project. So you will have to see whether they have a specific, preference for using a specific model or a recommendation, or if you have to tie it to a theoretical model. So it's things that you have to think about that. And then also one of the things that I will say is the 3 F's for program planning. So I'm going to talk about them really quick, but that is fluidity. So those the steps are sequential, all build upon one another. So to do 1, you have to do step 2 to 3, and so on. Then the flexibility, planning is adapted to the needs of the stakeholders and modify as needed. So are you able to be flexible into moving things like that around and adapted? So if you work with community settings, you know that things go unplanned. For instance, you may have a natural disaster like a hurricane or a fire, or you can have issue like a global pandemic like we had. So we had to adapt, and we had to find ways to continue providing that programming in a different way that was still effective for the population in need, and actually going to meet those objectives and goals that were clearly defined during your planning process. And lastly, functionality. So outcome of planning is improved health conditions, not the production of the plan itself. So are you actually achieving what your outcomes that you established? So in this case, like where you're trying to improve the health of your participants, or are you just doing, it's not about just like making sure your plan works at the end of the day, but you think about the outcomes of your participants. So now moving into program evaluation. So what is program evaluation? The systematic assessment of the design, implementation, or results of an initiative to the purposes of learning or decision making. So when is evaluation conducted? Or why first? So why is it important to evaluate a program? Actually, it's to demonstrate the impact of public health programs and services and measure outcomes of the program, the population health services or health outcomes. And then to meet funder requirements, demonstrate program value, identify areas of improvement, build and maintain partnerships, measure effectiveness and impact again, and contribute to evidence-based information. So when should an evaluation be conducted? Throughout the planning process. So during the design phase, the implementation phase, and the initiative is finished. You just want to make sure you are evaluating in different ways through needs assessments at the beginning of the planning, doing your focus groups or interviews, during your implementation, doing pilot testing, and seeing how you can adapt your intervention to measure the cultural needs, your population needs, and making sure it just making sure like all the bullet points that you have already created for your goals and objectives actually match the activities that you are developed. And then finally, during the evaluation process, of course, you want to see and assess whether the program is doing the intended outcome. So is it assessing the overall quality of the program, and also how the process in general function, like I mentioned, and then assess the effectiveness of the intervention and measure the degree to which those strategies or activities actually improved at health behavior or health outcome. So here is a little bit of a graphical representation of when evaluation is conducting. So again, since the planning process through the start of implementation and end of implementation, you start with what we call the formative evaluation. Formative evaluation purpose is to improve the overall quality of the program or its components before it's too late or you're not able to make changes if you have like a limited time frame. And the overall objective or purpose is to attempt to enhance the program components before or during the implementation. So process evaluation comes under that category, and the purpose is to assess the implementation process in general and track and measures when went well or when went poorly, on how these factors contributed to the success or failure of that specific program or program activities. Then you move into the summative evaluation. And the purpose of this evaluation is to assess the effectiveness of the intervention and the extent to which awareness, attitudes, knowledge, behaviors, the environment, or the health status of that population that you target change as a result of that specific program and program component. And from there, you have is divided into two sections: the impact evaluation, which mainly focuses on the intermediary measures such as behavior change or changes in attitudes, knowledge, and awareness. So something that have a short to a medium term change. And the outcome evaluation measures the degree to which the program was successful in reducing or improving a specific health condition or a quality of life type of measure. In this case, could be food security, for instance. All right, so here I'm showing the CDC framework for program evaluation. Is something that is a framework that is usually recommended. And again, you may be familiar with some of these steps already. But step one is here up at the very top, and involves engaging stakeholders. So you have to ask yourself, who are the stakeholders? And those are those being involved in the operation, those serving or being affected directly or indirectly by the program, and those primary uses of the evaluation results or outcomes that you're trying to accomplish. And the scope and level of stakeholder involvement will vary with each program, and it depends again on how much involvement your partners are, or like how many time or resources you have to have those community stakeholders be part of that process. But it's highly recommended to always have somebody within the community that you are developing the program to be part of this process. Then step two is again describing the program, sets the frame of reference for all subsequent decisions in the evaluation program. So describes again the mission, the vision, the goals, the objectives, the capacity you're able to affect change based on the assets or the barriers that you may encounter in the communities, and then how it fits into the larger community. So sometimes you will hear people developing logic models that is a framework tool to help you see it visually how the inputs are able to develop activities and generate outputs, so you can evaluate those specific activities into the short-term, medium-term, and long-term evaluation outcomes of your program. Then step three focuses on evaluation design. So making sure the interests of the stakeholders are addressed, and also identifying the reason of evaluation. So how will be used, the questions that are going to be asked, the part of designing the evaluation, and also any agreements about the process. So whether it's collecting surveys, is it going to be over the phone? Is it going to be online? Is it going to be in person? How long the questionnaire is? What type of measures are you trying to collect? And any other things regarding that type of the evaluation design. Then Step 4 is gathering credible evidence. So deciding on measurement indicators and sources of evidence for collecting quality and quantity of evidence, and as well as thinking about the logistics for collecting evidence. So organizing data, including specific processes related to coding, filing, cleaning. So for instance, if you are collecting a lot of surveys and you're doing a pre-test, post-test, and follow-up, like how you're gonna match it across those participants. If you are collecting from different states, how you're gonna keep that coding dictionary or framework so you can analyze systematically across all those sites. So having a point of reference that you're able to gather credible evidence and there's no biases that may overshadow any of your findings. Then number 5 is justifying conclusions. So comparing the evidence against the standards of the of acceptability. So usually what is already out there in the community or evidence that have been published based on a similar program. Also judging the worth, the merit, and significance of the program, and creating recommendations for actions based on the results. So again, it's not about just assessing, but also reflecting on what you learn and how the results from your program were able to improve the quality of that community or that specific setting of population, and what it is recommended for other researchers or government officials or anybody to address what is the gap, what is the need, and what are the future steps. And again, this goes hand in hand with step 6, which is ensuring the use and sharing lessons learned. So use your results for dissemination to create similar programs, to adapt them in different communities, and also share it with your stakeholders that help you from the very beginning that these were the needs of your community and these are the findings and what are the next steps, as well as share it with other key stakeholders. So those funding agencies and any collaborators that help you get to developing that program. So what is the relationship between planning and evaluation? Again, evaluation involves assessing progress towards those goals and objectives. So it's very important to have and set clear and smart goals and objectives in order to develop those intervention activities and intervention strategies, just to be able to have an indicator of what you want to evaluate. So matching the activities. So for instance, if you are delivering a nutrition education class, like how it's specifically focusing on parental feeding practices. So how do you want to assess the knowledge of those participants? So always going hand in hand towards what are the goals that you identify and what are the objectives with those program activities. Evaluation should be built into the planning process. Again, it can be from the very beginning until the very end, and it's a cycle process. So it just continues going. There's not a continue from where you ended to kind of inform the process again. And then planning can help determine if a program is ready to be evaluated. So if you go through all the steps that have been recommended and you do the evaluation as part as your planning process, it can help you determine where your program is at. So for instance, doing those pilot testings or just as talking with community stakeholders and sharing them what you already have and how to help you get into the next step. And then lastly, it will be planning can help to identify success indicators. Planning helps to identify who is responsible for what. So planning not only helps you have an idea of what those intervention activities or strategies need to be, but also who is going to be taking care of that and carrying those on. Yeah, so this was the end of my presentation. And again, this is very important as you consider using those tools that you may be learning in the conference and how those can help you assess the programs that you are developing. So I guess if y'all have any questions, I'm happy to answer those right now. Okay, so we have one question and it says, which planning model have you used? Could you please share with us your experience? Yes, I have used, and I can go ahead and try to share my screen again so you can have a better sense of what I'm talking about. But I've used a precede proceed model, and that one is very helpful because it makes you think from the very end of what is needed to be evaluated to the very beginning. So it's like a sort of like a cycle, and it gets you to better understand like what is the problem, identifying the problem from the very beginning, but also measuring it with what you're trying to evaluate at the end, and then moving to these other phases to think about those genetic, behavioral, environmental factors that actually affect or contribute to that health problem, and then identifying those predisposing, reinforcing, enabling factors that align with those phase 2 factors, and seeing like, okay, so we know that, for instance, in food security, your knowledge about how to access healthy foods may be a factor contributing to food insecurity, maybe generational status on the food environment in your home. So how your family in the past have done in relation to accessing healthy food. So you may have learned that behavior from, your support systems. And then those enabling, so if you don't have like a farmer's market or a supermarket near you, then that provides helpful items, and you only have convenience stores that make it harder to access our helpful foods, that may increase your chances to being food insecure in your community. So identifying then those policies and strategies, and then developing that evaluation process that matches those predisposing, reinforcing, and enabling factors. So for instance, if you're developing nutrition education and you're also creating a system change in which you are bringing into your community a mobile market, and they're providing vouchers for them to, access those fruits and vegetables. So how those different components from your program are able to improve food security at the end of that population, which is improving the quality of life, when you have healthful foods into your diet. So I hope that helped answer your question.
Thank you for presenting today. And I will wrap by reminding everyone the next session will begin at 3:15. Please take a moment to take a sip of water, stretch yourself out, and then head back into the main room. To return to the main room, please click the black box at the top right of your screen. Thank you so much.
Thank you.